Restrict gatherings and implement stricter guidelines for the taxi industry. That's the word from the South African Medical Association. It adds that implementing lockdown level 5 would be counterproductive at this stage. SAMA says government needs to strengthen the healthcare sector by employing more people and vaccinating healthcare workers as soon as possible. Silindelo Masikane reports.
The daily number of people getting infected by COVID-19 has breached the 20,000 mark, and speculation around the return of lockdown level 5 is rife. Scenes from hospitals across the country paint a very bleak picture, with healthcare professionals working overtime, battling to keep patients alive with minimal resources. But the South African Medical Association says renewed calls for a return to a harder lockdown will not achieve meaningful results in the fight against COVID-19.
Maybe a stricter restrictions on gatherings of people, bringing it down to between 10 and 20 people, regardless whether it's family gatherings or any social gathering. That would add a lot of value as well. We also would again like to see what is, the transport. If you look at the taxis, it's still a huge concern to us.
Many businesses are still trying to recover from the effects of the hard lockdown last year.
Level 3 is hard enough for some sectors like the hospitality sector, the beverage sector. To expect an even harder lockdown for businesses would be our worst nightmare.
And when it comes to vaccination, it seems politicians and leaders will have to step up.
I cannot tell you to go and vaccinate and then I myself don't want to vaccinate. It's not fair, it's not right. So it should be a public type of vaccination for all the leaders out there as well as the politicians.
According to the SA Medical Association, doctors and nurses are going to thin out due to exhaustion, and lockdowns are not the solution. Employing more healthcare workers is where government needs to start. Silindelo Masikane, Johannesburg.